8:30 right now, and we are now very glad to welcome New Jersey's First Lady, Tammy Murphy, to the show. Since launching her Nurture New Jersey initiative in 2019, she's led the charge to make New Jersey the safest and most equitable place in the country to give birth and raise a child. And she just hosted a Nurture New Jersey Family Festival in Plainfield, connecting families with vital services, healthcare, and support. First Lady Tammy Murphy, thank you for joining us.
Thank you for having me, Ken, and thanks for being interested in this topic.
Absolutely. I'm not going to delve into politics, but I'm sure in the back of your head, you're glad you're not in any way part of all the stuff that's about to come up. I'm sure now that you could spend your time helping people, which God bless you. And I mean that. God bless you for doing what you're doing here. That's a great thing. So what made Plainfield a priority location for this latest family festival? And how do these events reflect the broader mission of Nurture New Jersey?
Sure. Well, Plainfield was our 23rd family festival that we've held over the last 7+ years, and we focus on hotspots. So we focus on areas in New Jersey, pockets where either there's low birth weight babies, or tragically maternal mortality rates, or preterm babies. There's all sorts of statistics that we look at to cover and understand the health of the community. So this one, we happened to get to Plainfield, which was fantastic, and we had over 1,300 people come. But it's essentially a family festival is a cross between a job fair and a block party, where we bring state, county, and local resources together in one place for one specific period of time, and we help as many local residents as we can. We advertise in advance. I go speak in churches and through the faith community. We work through the public school system, the local government. So it's kind of an all hands on deck moment, and they've been super successful and really have helped us to expand our social safety net all across New Jersey.
And I'm sure a lot of those folks who came had no idea that any of those services existed beforehand. So it's wonderful that you're presenting it, especially, look, comes right down to the reality. No matter what your politics, it doesn't matter. We're talking about a woman with a baby or soon to have a baby. We want to have that baby live, healthy, and good, and that woman be able to care for that child. This is a beautiful thing. And what stood out to you during this festival? Was there any particular stories or organizations or community moments that left a lasting impact?
Listen, at my peril, do I highlight one of our providers and not all, because we have somewhere between 50 and 100 who show up at every single one of these, and they are universally just really dedicated to their mission. It's always on a Saturday, and it's in the middle of the day, and it was another nice day here in New Jersey, unlike today, I guess. But it's really special to watch. I'll tell you, one of the family festivals, I literally witnessed a WIC check being handed over on the spot. At other family festivals, you can just see the enormous glee that a family can find when they find out, oh, there is someone out there who will help me with, housing or with transportation. I mean, there's so many different aspects of caring and uplifting a community, and it's not all explicitly health. There's a lot of other factors that go into it. You've heard over time of the social determinants of health, ACEs, all these things collude to make communities unhealthy, and it's really great when we're able to jump in and provide those resources on the spot.
Yeah, it is sickening to think that there are some women who will lose their child simply because they do not have access to the proper health care, medical. They either can't get to a doctor, can't afford a doctor, don't know where to find a doctor as they're going on in their terms. And it is so essential that they realize that there are agencies out there to help them, other women who can help them through. But it is just so unfair and so sad that there are women who then lose their child because of this. And since launching Nurture New Jersey in 2019, what do you see as the most significant changes or improvements in maternal and infant death outcomes across the state of New Jersey?
Listen, there are myriad benchmarks that we follow. So let me just stipulate that up front. But when Phil came into office 7+ years ago, New Jersey was 47th in the country for maternal mortality rates. And that is completely unacceptable, and particularly when you understand that the inequities in care are rampant. And so we have now, through a lot of hard work, through bringing together many stakeholders, I mean, thousands now of stakeholders, not just across our state, but around our country and honestly around our world, where we've been stealing best practices and setting up alliances to make sure that we understand what we should be doing here in New Jersey. What have we done? We've moved from 47th to 28th. But again,
Wow.
there's a lot of other metrics I could share with you. My husband has signed over 70 pieces of legislation in this space alone, which are directly targeting the challenges that we face here in New Jersey. And I could walk you through all of that, but the three I would say that are super important are: one, we've expanded Medicaid coverage 365 days postpartum, which is a game changer, because what most people don't understand is that the bulk of maternal mortalities occur postpartum. And secondarily, we have created the first and only in the country authority that's solely dedicated to moms and babies. So we are the
Mm.
only state in the country that's doing this. And through that authority, we are building what will be the first in the country innovation and research center focused on moms and babies. So you think about the country, you think about all the cancer centers we have and all of the heart centers we have, and I'm not denigrating those by any stretch. We don't have one for moms and babies, and yet the United States is 57th in the world for maternal mortality
Mm.
rates. So we're building that in New Jersey, and we are an open book. That center is going to house everything from a data collaborative and policy research to be a workforce training center. It's going to provide clinical care, of course. It's going to be an innovation hub where new ideas for tackling some of the challenges pertaining to moms and babies can be explored, and hopefully find new solutions that heretofore have not been presented. So there's enormous opportunity there. And then the last thing I would say is we've started something called Family Connects NJ, which is the most robust universal nurse home visitation program in the United States. Essentially, when a family brings a baby home, the mom is not seen for 6 weeks in normal circumstances. A baby is seen sooner. So we've decided, why don't we send a registered nurse into that home? It's free of charge. There's no stigma. So a registered nurse will show up in a home within 2 weeks of delivery and spend up to 90 minutes with that family, checking on the health of the mom, checking on the health of the baby, and seeing if there's other ways that we can be helpful as a state. So if there's additional resources that are needed, we can connect that family with those resources. But this has been a game changer. Of the thousands of I think now we've served 3,700 families since we launched at the beginning of last year. 17% of those the moms and babies were referred back to either the ER or to their primary care provider for a serious issue that was caught early and means not a real challenge down the road. And of those 3,700 we've seen, over 75% have been referred to other services that New Jersey provides. So this is potentially a real game changer for our state, and I hope other states will follow us. And I look forward to rolling this out through the entire state by January of 27.
What a beautiful legacy too for you, and for the state. Not just you. Obviously, you started this, work with this, but what a beautiful legacy to leave behind as well. And just the idea. I mean, just speaking in human language here, having
Yeah.
dealt with a family of means,
Mhm.
when a young woman has a child, it is so much work. It is round the clock. It is constant crying and changing of diapers. I can't even imagine if you are a woman who does not have the family, does not have the money, does not have the support structure around them. I can't even envision what that young woman is going to. I can't, how they get through that. So the idea of having a nurse, just knowing that a health professional can come to them and answer questions and help them through the most critical time as that infant is there and it's new for the mother, etc. What a blessing. What an incredible blessing, sent from heaven that must be for them. Brilliant idea. And I can't even believe that this isn't something nationwide already.
Well, it's something that many countries do, and they do. We will offer up to 3 visits of 90 minutes each, but many countries offer weeks and weeks and weeks of this. So we have a lot of catching up to do, but we have to prioritize the health of our moms and babies. And the good news, by the way, is that moms and babies are not a partisan issue. Everybody agrees that we need healthy moms and babies. And anybody who looks at the numbers understands that if we take care of those moms and babies today, the monetary benefit to our state and to our country and our world down the road are infinitesimal, in all honesty. Whether it's healthcare coverage, whether it's participating in the workforce, there's a million ways that this can be measured. And so this is not only the right and moral thing to do, but it's the smart thing to do. And we are going to continue to make New Jersey the safest and most equitable state in the nation to deliver and raise a baby. I'm going to run through the tape, and that's what we're going to do.
Mrs. Murphy, how does the recently formed Maternal and Infant Health Innovation Authority help ensure the work of Nurture New Jersey continues beyond the time that you will leave as First Lady? I know you're going to still keep working with them, but
Yeah.
how will we be ensured that it continues beyond?
Yeah, so Ken, this kept me up a lot, very many sleepless nights, concerned that I've had the ability to convene people and bring thousands together with this initiative, and there are so many good people out there who are working away every day to try and solve this challenge. But what happens when Phil leaves office? I'm really thrilled that the authority has been set up. It's, as I said, it's the first in the country, the first state authority that deals with moms and babies only. We have an incredible woman by the name of Lisa Asari who is running the authority. She will, and she's got a great board. We've got people who are from the community who are on the board. We've got people who are experts who are working together, and she is now going to pick up the reins from all that we're doing, and as she now works alongside us. And once we leave office, then she will be the focal point, and she will help run this charge and lead this charge to make sure that everything keeps going.
Well, New Jersey's First Lady, Tammy Murphy, what a wonderful thing you're doing. Thank you so much for doing it. And thank you so much for joining us this morning. We'd love to have you back anytime. Please talk about this anytime you'd like. Have a wonderful, wonderful day.
Thanks, Ken. Really appreciate it. Have a great day.